Hello, this is Dr. Jiang, also named Dr. Bei by my students. In my video of Learn Like a Doctor, I advocate learning medicine from patients, when not in person, by using Scope, a novel, immersive case-based learning platform that simulates clinical practice with high fidelity. That is a top-down approach. Another approach, bottom-up, is equally essential in learning medicine. When top-down meets bottom-up, authentic integration occurs. Misdiagnosis is reduced, atypical cases are recognized, and ambiguity is managed properly in clinical practice. No matter what you design, either a curriculum or a learning platform, a sound and solid approach to medical education offers learners the opportunity to engage in learning from both top-down and bottom-up perspectives, empowering them to develop into competent professionals down the road. It is funny how old memories come back so vividly as we age. After 3 years of intensive basic science learning in my 5-year MD program in China, I entered the clerkship year. My 7 roommates and I realized we had been taught in the wrong direction. Information from the patient came to us in the opposite direction as we learned in the classroom and from the books. We discussed and laughed about it, feeling quite complacent about our own insightfulness. However, it didn't take long for us to appreciate that learning in both directions, from top down and bottom up, is essential to mastering medicine. Knowledge must be organized to ensure it is easily accessible when needed. Medical knowledge, in particular, has a unique hierarchical structure when approached systemically from bottom up. The intact system of medical knowledge is like a grand mansion. It is magnificent and takes time to build. Anatomy serves as a foundation, with medical terminology as the starting point. Learning progresses from gross anatomy to microanatomy, which is histology, and to the process of structural development, that is embryology. When learning anatomy, you may start with gross anatomy to get the big picture first, then progress to regional anatomy at the advanced level to examine structures of different anatomical planes, which lays a solid foundation for understanding medical imaging and surgical practices. A thorough understanding of the structure paves the way for exploring functions, that is, physiology. In-depth understanding of physiology is intricately tied to biochemistry, which provides the chemical and molecular basis for physiological process. On the other hand, medical biochemistry is best understood in the context of physiology. An equally important subject to biochemistry is biophysics, which is highly relevant to imaging and laboratory diagnostics. Microbiology and immunology are about our attackers and the defense system, and microbiology encompasses bacteriology, virology, and parasitology. Microbiology itself is an enormous subject. A few critical bridging subjects that connect basic medical science to clinical practice come into play. Pathology, which is essentially abnormal histology, pathophysiology, and pharmacology, which is built upon the combination of physiology and biochemistry. Epidemiology and behavioral science offer a broader perspective in medicine. Clinical medicine encompasses internal medicine, surgery, pediatrics, obstetrics, and gynecology, along with specialties such as psychiatry, emergency medicine, anesthesiology, dermatology, ophthalmology, otolaryngology, and radiology. Interdisciplinary fields include oncology, geriatrics, sports medicine, rehabilitation, palliative care, tropical and travel medicine, and so forth, with new subjects continually added as modern medicine evolves. To list all of them will make this map very crowded. If you split this diagram into two halves, you may notice all foundational science subjects are clustered to the left, while clinical practice subjects are on the right, with pathophysiology sitting right in the middle. Yes, that's right. Pathophysiology is the true bridging subject between basic medical science and clinical practice, and it is a foundation of diagnostics. Diagnostics itself is a profound subject with clinical reasoning as its core. The subjects directly related to diagnostics are physical examination, imaging, and clinical laboratory diagnostics, which itself includes clinical chemistry, clinical immunology and serology, clinical microbiology, hematology, body fluids and urinalysis, molecular diagnostics, and blood bank and transfusion medicine. As the backbone of diagnostics, pathophysiology illuminates all the data collected from patients' medical and social history, physical examination, laboratory testing, and imaging studies, interleaving them to reach the appropriate diagnosis. With a complete understanding of pathophysiology, being knowledgeable and skillful at communicating with your patient to obtain relevant information, and competent at a physical examination, most of the time you do not need any testing to reach the diagnosis, but only to confirm your hypothesis. The crucial role of diagnostics in clinical management is clear. Once the correct diagnosis is established, you and your patient work collaboratively to assess the risks and benefits of available treatments. More aggressive strategies may require surgery. Conservative approaches include medication, physical therapy, and so on. Effective clinical care depends on interprofessional collaboration among nurses, doctors, clinical laboratory scientists, and many other allied health professionals. Strong preventive medicine and public health reduce the overburden on these teams. Let's not forget philosophy, with medical ethics a part of it. It guides us through clinical reasoning to logical decision-making in the complex realities of medical practice. Regardless of the curriculum you follow, this framework of medical knowledge may guide you to a comprehensive understanding of many diseases and your patients. There is a good reason that such a discipline-based framework has persisted for many years. It allows us to explore the human body from different perspectives and organize medical knowledge onto multiple shelves. The multiple ways of processing and storing the same information make it easier for learners to retrieve and apply knowledge to many diversified contexts where diseases develop. It helps learners to see big pictures from different perspectives in a systemic manner by maintaining the continuity and integrity of medical knowledge. Given that the human body is the most complex machine, it is not surprising that the system of knowledge describing it is intricate. Any gap in medical knowledge can lead to misdiagnosis and inappropriate management. Soon, you will realize medicine is not only a problem of natural science, but a complex system intertwined with social, political, economic, and cultural factors. In learning medicine, we are never humble enough. The more we learn, the more we realize how ignorant we are. Staying humble may be the very top characteristic of the great doctors around the world. The humbleness grounds us and keeps us growing as we look into the most sophisticated creature in this whole wide or wild world. Again, this is Dr. Jiang, also named Dr. Bei by my students. Thank you very much for your attention, and I'll see you in my next video.